Welcome to the Diversitech Healthcare video series on the Chicago classification with ZView. This video gives an overview of what is new in ZView as it relates to Chicago 4. In the 1990s, Dr. Ray Klaus addressed the need to display high-resolution esophageal manometry data differently than simple conventional data. He developed the pressure topography plots we use today. The conventional analysis algorithms fell short in describing the data in these interpolated topography plots. Hence, the Chicago classification criteria for esophageal manometry disorders was developed. The Chicago classification includes novel marks and metrics and normal thresholds specific to high-resolution manometry, along with diagnostic criteria for major motility abnormalities. The Chicago classification was originally published in 2009 as a product of the International High-Resolution Manometry Working Group. In 2012, the working group collaborated on several articles comprising a supplement to neurogastroenterology and motility that later collectively became known as Chicago Classification version 2.0. Chicago 3.0 followed in 2015. Chicago 4.0 was published as a main article in January 2021 by the International Working Group, comprised of a greatly expanded team of world experts. They went on to publish 7 subsequent technical review notes throughout 2021, each focusing on a different diagnostic classification. The review articles present a discussion and details to support the main article. Each is a wonderful resource for the interpreting physician. Previous versions of ZView were based on Chicago 3. With them, we have been able to provide most of the data on our reports for swallow types mentioned in Chicago 4. The physicians could consider this data in light of the thresholds and criteria recommended in the newest publications. In 2025, we release ZView 3.4. Introducing our Chicago 4 compatible software. ZView now includes guided steps and unique measurements as discussed in Chicago 4. In the ZView analysis, we have added marks for the EGJCI intrabolus pressure value, intrabolus pressure pattern IBPP, and the inhibitory DCI. This last mark is unique to Diversitech software and is applied in the multi-rapid and rapid drink challenge measurements, as described in the Chicago 4 publications. Each measurement type has specific analysis marks, metrics, normal values, and composite thresholds. Here are a few examples. Using the updated analysis, Chicago 4 brought several changes to the diagnostic criteria. The biggest changes were in the thresholds for EGJ outflow obstruction and ineffective esophageal motility. ZView software displays motility patterns based on the Chicago values. Importantly, these patterns do not constitute diagnoses. Instead, they serve to draw the clinician's attention to patterns that may be used in their diagnostic interpretation. The patterns may also guide consideration of other provocative or ancillary tests, such as time barium esophagram or FLIP procedures. Our pattern classification underwent the greatest upgrade, listing both a major and minor classification. If criteria are met for more than one pattern, a pattern qualifier of monometrically conclusive or inconclusive, informed by the Chicago 4 publications, was added based solely on the manometric data. The patterns and qualifiers populate automatically based on the Chicago metrics, considering supine, liquid, and upright swallow data as appropriate. As always, the reviewer remains in control of automatically populated fields such as the inner bolus pressure pattern, pattern classifications, and qualifier. Our reports include sections for each swallow type, with metrics, thumbnails, and normal values for each measurement type specific to Diversitech probes. Though our software doesn't correlate symptoms, patient complaints can be marked in real time and then manually mentioned in the study summary, which goes to the report. This is especially valuable for criteria that require positive symptoms such as EGJ, outflow obstruction, distal esophageal spasm, and hypercontractile esophagus. The acquisition screen has buttons for chest pain and dysphagia, and a custom symptom button to add others. Our reports remain customizable to meet the needs of the manometry team. As before, the ZView software allows for network connectivity, so each member of the motility team can have access to full studies and reports from their location. Our help pages, analysis, and training guides have all been updated for the new features.